Hi, my name is Wendy, and I came out to California from Pennsylvania to hopefully find some answers, which I've been searching for so long, as to why I feel so horrible every day. I have numerous diagnoses. I have burning mouth syndrome. I have IBS with constipation. I have vulvodynia. I have Raynaud's, anxiety, depression. So many, I forget the list sometimes, But the burning mouth syndrome took over the pain, like with all the other symptoms that were going on. I did a ton of research online, saw doctors. All they want to do is give you medicines to manage the symptoms. And I've been on medications for most of my life. And they only make me feel sicker because I get more symptoms, side effects with the meds. I felt like coming out here was probably my last chance of hope, because I've just exhausted all other possibilities at this point. My pain level varies throughout the day. Sometimes, even with the pain medications, it was still at an 8, making my life miserable. We stopped going out to eat. We stopped doing everything fun in life. I basically was a slave to my medicines and my diseases or symptoms. This is the vicious cycle I've been in, especially for the last 2 years. The burning mouth has been about 2 years, but the vulvodynia and the depression and the anxiety, that's been at least about a decade.
Wow.
And the digestive issues only got worse after being on the medicines. So I've seen digestive specialists in my area. They had me on Prilosec and other types of drugs to try to help with acid reflux and all this other stuff. And, I've kind of lost hope in the doctors in my area. I really have. So I just want to give people out there that are looking for an answer some kind of hope, because there is, especially with the burning mouth, because it seems to be so rare and nobody knows about it. And even the vulvodynia, a lot of people don't know that. And I was seeing a specialist for vulvodynia, and of course he taught me how to do some bladder installations, which again involved medications instilling into my own bladder, and also topical steroid creams to put on. So more and more medications. And I don't want to do that route anymore, because I know that I was only getting sicker every day with being on these medicines. When I spoke to Dr. Tina over numerous emails, I was at my wit's end. I had a lot of work stress related things going on, and being in chronic pain every day takes a toll on your body. You're moody, you're miserable, you're just stressed out to the max. And again, I was trying to see people to help me with my adrenal fatigue and all this other stuff. And I was doing foot detoxes at home, thinking, I could detox my body through foot baths, and just nothing was working. All the supplements were just making me feel more like, why am I taking all this stuff?
Right.
So I knew that I had to get back to feeling human, because all I felt like I was doing was feeding myself pills all the time. I would eat a meal and I would be like, oh, now I have indigestion, I have to take this. It's just a constant. I was on Miralax every day. And since being here, I've been able to have bowel movements, despite being on medications that make me constipated. I've been able to have some bowel movements for the first time in a long time on my own, you know, by drinking more water and the treatments that Dr. Jodie does. And that's huge, because if you're not eliminating the toxins, then guess where they're at? They're in your body. So I've learned so much by being here, and it's just been a mind-blowing experience. I don't know how else to say it. It's just it's wow. I would say day one, when I came out here, I was still at my normal probably pain level of 7, 8, you know, lips swollen. As the days went on, day 2, you know, a little less, but still felt toxic, you know. Day 3, I think, is when I noticed some changes in the way my pain was, you know. Probably dropped down to maybe like a 5. And I think by the weekend, which was after 5 days of treatment, is when I really started to notice. I was able to eat an orange for the first time in about 2 years. So that was huge. Just being able to eat different foods that I didn't think I could eat anymore. I'm suffering from basically, in my mind, malnourishment, because I haven't been able to absorb properly from my digestive tract not working properly.
Right.
And when I came out here, I had all these puzzle pieces from different doctors saying, this isn't working, that's not working. You know, you need to heal your gut, you have leaky gut, you know, you have a liver that's malfunctioning. You know, I knew all of this stuff. I just didn't know what to do about all of it. And that in itself gave me anxiety every day. Because you have all these doctors and professionals that don't know what to do, because my symptoms were so many. And Dr. Jodie knows about all these symptoms. He knows when the body goes wrong, you know, and that is great, because a lot of people out there who are educated, in my mind, I've lost trust in a lot of the doctors in my area. I mean, I didn't really fully trust them in the beginning anyways, but, you know, with being let down by just, oh, here's another prescription for this pill or that pill,
right,
you know, and I've tried to heal my gut. I've been working on my gut for over 2 years. I've been seeing a nutritionist, a different nutritionist. You know, bottom line is, unfortunately, that you can't heal your gut if you're on medications. You know, it's affecting the receptors, as Dr. Jodie calls.
Right.
You know, and I didn't know how to come off the medications without being so depressed about the pain and just the everyday suffering. I mean, it gets to a very gray area, very black, dark place in your life.
Yes.
When you're on these meds all the time. Like I said, I remember mentioning to some of the nurses I work with, I'm an LPN, and I said I feel like I'm a slave to my medications, you know, and I don't want to live life like that. I don't. I'm currently on my 8th day of treatment with Dr. Jodie, and on about the 3rd day of treatment, my pain level had dropped drastically from like a 7, 8 to probably about a 5. In my mind, that's huge, because even being on the meds, it was barely manageable. And then currently now on day 8 of treatment, I'm down to anywhere between a 1 to a 3. My pain varies throughout the day, so I can't give it a definite number, but 1 to 3, and I still have 1 day of treatment left. So it gives me hope that my pain will decrease as treatment goes on and as time goes by, and as I be able to come off more of my medicines, I'm hoping that will heal my body so that I can start to function normally without the aid of medications, which I wasn't functioning normally anyways. I was just basically going through the motions of life, but not really living it. The vulvodynia pain, I still have pain there. It's there all the time, but the lip pain took over, it seemed, for the last 2 years, and I was able to kind of ignore the bladder pain because I have interstitial cystitis as well, which goes along a lot of times with vulvodynia. It's basically redness and swelling and irritation in the vulvar area. And, you know, like I mentioned before, steroid creams. I was given installation to do by a specialist that you install lidocaine and sodium bicarbonate and another medication, Elmeron, to help relax the bladder and kind of calm down the pain. I was doing bladder installations maybe once a month to try to help with the pain. They would help for a temporary short amount of time, you know. Dr. Jotti's treatment differs because he doesn't just treat one symptom. He looks at all the body systems and tries to figure out what is going haywire. And that's exactly how I felt when I walked in here. Haywire, like there's multiple symptoms going on. I felt like multiple body systems are failing. And when you say that to a regular general practitioner, they look at you like, what are you talking about? You know, they don't dig deeper, you know. Dr. Jotti, he is constantly asking you about your pain level, which a lot of doctors don't do. Honestly, like they don't ask you what's your pain level, you know. But he's constantly monitoring you while you're going throughout his treatments. So the treatments are very different from anything I've ever seen. I just want to, thank both Dr. Tina and Dr. Jotti for giving me hope again, that I will someday be able to plan my wedding and I won't be miserable and depressed about my pain. If you're suffering from multiple symptoms and you feel like there's no hope and you're tired of just managing symptoms with medication only and still in chronic pain every day, then you do need to get on a plane if you're not located near California, and come see Dr. Jotti, because he does amazing things, and I was able to see it with other patients that were here as I was here in treatment, that they are feeling better. Their pain levels are decreased. I'm seeing results with just a few days, and I've been on all my different medications for years and not feeling any better. So that's huge.